everyone. Thank you so much for joining us for today's NeedyMeds special topic webinar, Help for Medicare Open Enrollment. As you know, it's a timely and important topic, and we are thrilled to have our guest panelists with us here today. My name is Carla, and I am the Director of Education at NeedyMeds. And before we kick off today's presentation, I want to go over just a few things. One of them is that you can feel free to type any you may have at any time into the section of your Go control panel, but just know we will reserve answering questions until the end of the webinar. If we don't have the time to answer all of your questions, we will follow up with you personally via email after the webinar, probably by tomorrow morning or afternoon at the latest. But of course, we'll provide you with contact information at the end of the webinar as well. Also, the webinar is being recorded, and we will convert it into a video and make it available for viewing on the NeedyMeds YouTube page as soon as we can. And I will also be uploading the PowerPoint presentations if I can during the webinar, but if you're interested in receiving the PowerPoint presentations via email, certainly let me know and I will send them to you. So let's go ahead and get started. For those of you that don't know who NeedyMeds is, here's a snapshot of our current homepage. And I always put that up because really our website, along with our call center, are the faces of our organization. NeedyMeds is a nonprofit dedicated to educating and empowering those seeking affordable health care. And we define the education portion of our mission in two ways. First of all, by educating people about NeedyMeds, and of course, but also we define education by letting people know or educating them about other invaluable resources and timely healthcare topics, which is why we are so pleased to have our guest here with us today. So it's my pleasure to introduce our host, Cynthia, from the Executive Office of Elder Affairs. Cindy received her MSW at the University of North Carolina, Chapel Hill, worked for SHINE, which stands for Serving the Health Insurance Needs of Everyone program, or SHIP, for over 20 years in various capacities, and as the state director for the last 8 years. Cynthia serves on the National Committee, the Senior Medicare Advisory, and Senior Care Options Advisory Boards in Massachusetts. Without further ado, I'm going to go ahead and pass the mic and the screen to our guest. So please bear with us while we make that transition. And this may take just a moment, everybody. So thanks for your patience. Oop, bear with me. So Cynthia, I'm going to go ahead and pass the screen to you. And let me know. There we go. And you should be able to grab it. Thanks, everybody, for your patience, and enjoy today's presentation. Beautiful.
Thank you, everybody.
And that looks great, so you're good to go. Thanks, everybody.
Good.
Enjoy the presentation.
Thank you to Carla and NeedyMeds for inviting me to share what I know about Medicare Open Enrollment. And as Carla mentioned, this is designed to share Senior Health Insurance Counseling Program information, which is the SHIP program, with anyone who's interested in learning about Medicare Open Enrollment from our point of view. The SHIP program is administered by the Administration for Community Living, which is located in Washington. Well, what is SHIP after all? We are a state health insurance counseling program designed to assist Medicare beneficiaries of all ages who may have Medicare A and B and C and D, with Medicare rights. There are options under Medicare, any billing issues, any kind of transitional problems or issues between our marketplaces and Medicare, or employment and Medicare, veterans and Medicare, you know, whatever it is that comes up. We are the people who endeavor to help Medicare beneficiaries with those issues. They're located in every state and territory, and you can find your SHIP program by going on to shiptacenter.org, or you can actually call Medicare at that number, which is also Medicare, 1-800-MEDICARE. We are named a number of different things, which makes the SHIP program a little bit confusing to people, but we are basically trained in all the same information. Shine in Massachusetts, there's a Shine in Florida, Choices in Pennsylvania, High Cap, etc. We are all trained in the same information, and we'll endeavor to do the best job we can for our beneficiaries. So Medicare is one year when everyone with Medicare can make a change. They can get out of the plan that they were in, whether it's a Part D plan or Medicare Advantage plan, and purchase one or the other. If they had no plan, they could purchase a plan. If they only have prescription drug coverage, they could purchase a different prescription drug plan or a Medicare Advantage plan. And so this is an opportunity for beneficiaries to review the information they were sent in September from their current health insurance provider and see what their options for either better coverage that covers the medication better, more completely, gives them more access to physicians or therapies, and or find a plan that saves them some more money. We all like to do that. This is Medicare Open Enrollment from October 15th through December 7th, and we are coming up on it very quickly. The effective date of the open enrollment is January 1st, 2018. Not to be confused with the Marketplace or the acronym Obamacare. National Open Enrollment is 1st through December 15th. And in fact, it may be different in other states. In Massachusetts, for example, it's November 1st to January 23rd. So do pay attention to those open enrollment periods. So here's some information about the 2018 Medicare plan choices. And before we start reviewing specific plans, we do ask people to think about any changes they had in their healthcare utilization in the previous year, whether they had, any new illnesses or issues come up that demanded they go to the physician more often or PT or have more medications. Take a look at your financial status. Did you retire recently? Do you have less income? Are things changed at home that you have to be a little bit more concerned about your economic status? We're asking people to complete the pre-enrollment sheet. This is a sheet that was developed by Medicare and different state offices to help people list the medications, the specific dosages that they take per month or per week. Milligrams is very important, the type of medication taken, whether it's pill, capsule, extended release, their list of pharmacies. Do you have an issue with being homebound, or do you rely on a particular drug company to deliver them to you? Are you able to get out? Do you shop in the same place that has another pharmacy that would be better for you? And then to look at all the Medicare and other health insurance cards that people might bring in. If somebody actually has Medicare and a retiree plan, we really want to know that. We don't want to start signing them up for something that will bounce them out of that retiree plan. So we encourage people, bring your complete list, have it filled out on the enrollment sheet, including your pharmacy's providers, and bring all of your health insurance cards. So as you may or may not know, original Medicare consists of Medicare A and B. People generally choose to then add a Medicare Advantage or health plan to cover the gaps under Medicare A and B. And these often include drug coverage, or they could stick with Medicare A and B and add a supplement or a Medigap, which does not cover prescriptions. So then they need to add a freestanding prescription drug plan. And if someone chooses a Medicare Advantage plan and needs drug coverage, they actually have to use that plan's drug coverage. So again, people are looking at a number of options for coverage, what the benefits are, and what the costs are. When considering Medicare Advantage plans, it is really important to maybe ask your physician or the billing office, in fact, which plans the doctor or doctors have contracts with. Are the prescription drugs covered that are in your list that you are currently using? And then use the Medicare Planfinder to find those. We would compare premiums, co-payments, deductibles, and annual out-of-pocket maximums in each of the Medicare Advantage plans. And as I mentioned earlier, if you have a Medicare Advantage plan, you need to choose their drug plan, because if you chose a standalone prescription drug plan, bounce you right out of that Medicare Advantage plan. Very, very important to be careful about those distinctions. The other things that people look for within Medicare Advantage plans are, other benefits like wellness and health and things like that. So HMO versus PPO. Medicare Advantage plans have a broad range of benefits. The HMO has a more narrow network where the preferred provider organization, as it's called, might allow you to see more physicians. There may be a bit of a higher copay, but if you like to have that kind of access and flexibility, then that's certainly something to look at. There's a list, and in fact, it's fortunately on the Medicare.gov Planfinder list now. We're heading to last year, a list of the co-payments for the services and tests. You may not have a co-payment for a typical x-ray, but you certainly will have one for your MRI. So you want to be very careful about taking a look at those, especially if you have frequent visits to your physician. Looking at your prescriptions and what tier they're on, a tier 1 and 2, those are generally the generic types of medications. Oftentimes when people go into the donut hole, or should I say sometimes when people go into the donut hole, there are discounts for people who are in the tier 1 and 2 medications, and often those are less costly as well. If you are a traveler, you enjoy flying, your health is good, that's great. Make sure that if there are any travel coverage options in your Medicare Advantage plans, you are aware of those, or you know that you need to pick up travel coverage. The other benefits, which I alluded to earlier, could be wellness, gym benefits, Weight Watchers, eyeglass, dental, and vision options. It might be a discount for prescription glassware, or for fillings and things like that, and those might be important to certain people. Exclusive provider groups hadn't been as much of a concern in the past, but we are seeing that happen more and more, where a provider group will only accept one Medicare Advantage plan for new patients. So oftentimes if the group has a solid membership, they won't ask the people who are their members to change, but any new people who want to use those providers they have to go into just one of the Medicare Advantage plans and not the other. So that's something to look out for. Now, when considering the Medigap or the supplement plan, they cover whatever services Medicare approves unless you purchase a rider. That means they don't have the additional benefits most of the time, like the wellness benefits or the one exam per year, or some of the other dental, eyeglass, and things like that. The premium tends to be higher, and you still need to purchase a prescription drug plan. So again, we are looking at how much utilization a person has to help them determine and choose whether a Medicare Advantage plan or a Medigap plan is best for them. The one thing that's important to know is that the Medicare Advantage plans do have a maximum out-of-pocket spending limit where the Medigaps do not. And the spending limit for the Medicare Advantage plans has been $3,700, now $4,500, some of them, and some of them are $10,000. So again, that may or may not make a difference to somebody who's considering one of these plans. And I did mention that some of the providers are exclusive with a Medicare Advantage plan. Currently, at least in our area, Medigaps are used widely, and they're not specific to a provider plan. So we would recommend that if you have any questions about Medigaps and Medicare Advantage plans that might be more specific to your state, ask your SHIP program for information and enrollment options. So this is the Part B standard benefit. when people choose a Medicare drug plan, the premium can be anywhere from $14 to $140 a month. I know that sounds kind of silly, but it's true. We still have a deductible period, which some of the drug plans use and some don't. They can have a deductible of $400, and that means that if a person signs up with, say, Well Enough drug plan, they go to the physician, the pharmacy, the pharmacist says, well, you need to spend $400 before you can use this benefit. So people really need to know what their deductible looks like and be prepared to pay that amount before they can use the benefit. The initial coverage limit is that period of time where the individual is spending their copayments for the prescriptions, as is the drug company, and that's the full retail cost all the way up to $3,700. In 2018, that's bumped up $50. And I mentioned the deductible, but it was bumped up to $200 in 2018 to $405. So the initial out-of-pocket or the out-of-pocket threshold, or quote donut hole, some people want to see the word donut hole instead of that because they get what that means. That donut hole period is a little bit longer, and that's a period of time where there's no coverage from the person's drug plan. And asterisk, as you see underneath the chart, in 2018, after that amount has been reached, the beneficiary pays 35% of the brand name drugs and 44% of generic drug costs until the $5,000 is reached. Okay, so there was an arrangement with the pharmaceutical companies that generic and brand name drug costs would be covered somewhat in that donut hole or out-of-pocket threshold. When that amount has been reached, that's the catastrophic cost sharing, where the individual pays 5% or either of those costs for their medications. And I should mention that, we are keeping in mind that in 2020, knock on wood, the out-of-pocket threshold or donut hole will close, so 5%, just like during the initial coverage period. And that would be a 25% participation payment by the consumer year-round. Okay, so the donut hole doesn't mean closure of the donut hole doesn't mean people no longer have costs. It just means it will be consistent throughout the year. All right, and just to remind people that prescription drug plans, range in price, and if people are lower income and are eligible for extra help or limited income subsidy, LIS, then there are particular plans that are zero premium for them. So we'll always look at those. And in fact, when we go to Gov, you can do a personalized search and click on the box that says somebody is Medicaid eligible or receiving extra help, and that will flag the particular plans that have zero premium for you. In Massachusetts, for example, there are 7 plans that are zero premium. Now, zero premium is great, and we often look to it. If there is a limit, however, on the number of prescriptions covered under any of these plans, we will look for other plans as well. It might be worth it for somebody on Medicaid to pay $3 a month for a premium and get their prescriptions better covered. So, again, it's keeping your eyes open and making sure that you're making the right choice or helping the person make the right choice. Every year, there are discontinued prescription drug plans. Members of these plans receive notification by October 2nd with other information. It will include what alternatives are between Medicare Advantage plans and prescription drug plans and contact information. There'll be lots of other information available, including Medicare and CHIP phone numbers and information. In Massachusetts, we didn't have any of those plans go out, but we did have one plan stop and then, excuse me, those people re-enrolled automatically into another plan, or crosswalked, as they call it. The number of plans nationwide have been fairly stable. The premium nationwide decreased a little bit. Other changes with the prescription drug plans is that the plans are allowed to select certain medications and just do a 1-month initial fill. And I know the pharmaceutical managers are attempting to reduce that 1 month to a 7-day period. These are the prescriptions that are primarily opiates, maybe narcotics, those that really need to be monitored more carefully. The other piece of advice around the prescription drug plans is that there tends to be 5 tiers of medications. There may be a generic, a non-preferred generic, a brand name, a non-preferred brand name, and then a special brand name. All of these increasingly cost more money, of course. It could certainly be with one prescription plan versus another prescription plan that a prescription is on tier 1 in one and on tier 2 in another. So, again, putting your information into the Medicare Planfinder will help you find the least expensive plan, but take a look at all of the tiers and what might be available in another plan. The pharmacies offer preferred cost sharing with the prescription drug plans. For example, a Walmart versus a CVS versus Rite Aid, they might have specific contracts with the prescription drug plan. And they can vary dramatically between pharmacies. We do recommend people look at least 2 pharmacies when they run the Planfinder. Whether it's one where they normally get their groceries, one that's nearby but they don't usually go there. Maybe look at their favorite pharmacy versus another pharmacy, just so that they have the most information. The other thing that we want to make sure people know is that, it could be that during the year following in 2018, the prescription cost changes because that's allowed. That's another time to go and back and try different things, like talking to your physician about another plan on your drug formulary that can do the same job. It might be searching for a different pharmacy. It might be looking at a pharmaceutical company or trying something else. So anyway, there's always something to try. We've been recommending that people don't put the Part B medications into the Planfinder. These are prescriptions that are covered under Part B, a small number of them compared to Part D, but please don't put those in. These are the prescriptions covered under durable medical equipment supplies, such as a pump for people with diabetes, if the insulin is used with a pump, or with a nebulizer that's connected to the Part B equipment. So those particular drugs would not be on the D plan and would really change your costs quite a bit. Some injectable drugs that are not self-administered might be covered under B instead of D, and some of the immunosuppressive drugs as well, if a person's on Medicare at the time of a transplant. Some oral cancer medications are covered by Part B, and there are, I think, only a couple of them, as I was reminded today. So, it's just a heads up to check on those if anybody is taking those, to make sure they're not under B instead of D. So when we go through our training and talk to people about Medicare Open Enrollment and that the time frame is until December 7th, there can be a little bit of panic in people's throats, but we do want to assure people that if there is an issue with their drug plan or even their Medicare Advantage plan, there are ways to make a change after December 7th. A number of states have a state pharmacy assistance program where an individual is allowed one, what they call special enrollment period each calendar year. If the person uses it in December, that's counted for 2017, so there will be another opportunity in 2018. People who have extra help because they're lower income or they're dual eligible, so they have Medicare or Medicaid, currently they have a continuous special enrollment period. So if all of a sudden one of these folks is prescribed a medication that has a higher copayment than they're comfortable with, or it's not covered under their plan, or there's some other kind of issue, they could actually get out of the plan every month if they have to. For individuals who, because their income or assets changed, lost their extra help as of January of next year, they have a longer time period to make a change to a different prescription drug plan. So they should be seeing a SHIP counselor, hopefully during that time period, or getting some good help. Now, the 5-star plan special enrollment period allows a person to get into a plan at a different time during the year, and I'll go into that a little bit more in another slide. The Medicare Advantage disenrollment period is January 1st through February 14th. And the next slide explains that a little bit more. Okay, so the disenrollment period allows people who are in a Medicare Advantage plan to get out of that plan and return to original Medicare. Again, that's Medicare A and B. And they can do that from January 1st to February 14th. They cannot switch to another Medicare Advantage plan, and they cannot switch from original Medicare to a Medicare Advantage plan during that time, unless they're using a 5-star plan, which will be explained in a minute. So during that time frame, January 1st to February 14th, they can get out of a Medicare Advantage, back to original Medicare, which is A and B, and this will allow them to join a prescription drug plan, which is Medicare D. In some states, Medicare supplement plans are open year-round, so an individual could pick up a Medicare supplement plan too, but that may not be true in every state, so I just want to add that in there. Now, the 5-star plans have not been announced yet. They usually are announced in November, and this is because some of the Medicare Advantage plans, or even prescription drug plans, have excellent ratings based on service, lack of complaints, a positive member experience, the pricing, patient safety, the prescription management protocols, screenings, and management of chronic conditions is very good and merits a 5-star rating. This time period where the 5-star rating is effective is from December 8th, right after open enrollment ends, to November 30th. So there's that time frame where somebody could actually switch into one of these. We've seen that happen during the year, where someone, finds that they have a multitude of new prescriptions and their current plan is not working for them anymore, or it could be that somebody's in a very small network with a Medicare Advantage plan. All of a sudden, the physician is gone. They don't like any of the physicians left. They want to get out of the plan and into something else. It does provide an option for everyone under the 5-star plan in their state to make a change. And again, it's one time a year they can enroll into that 5-star plan. If they're enrolling into a Medicare Advantage 5-star plan, they must meet the eligibility criteria. In other words, have Medicare A and B, of course, and be in that particular service area. So Part B, we are still waiting for the actual definition or a decision, which should be coming along soon. We have heard that the projected cost of living is going to be 2.2%, and often the Medicare B premium increase will be about that amount. The concern is people who have very low income who receive the cost of living increase and what that will mean for their increase in their Part B premium. There is a hold harmless provision which prevents the premium from going up higher than what their change in Social Security will be. So once we see those numbers, we had projected that it would be 134 for everyone, but I do believe there will be some lower income individuals for whom that will not be true. Income related premium adjustment, or IRMA. So beginning in 2018, income thresholds are decreasing. Some of this language is kind of confusing, but what that actually means is people who, because of their income, have to pay more, there'll be a larger group because the thresholds are decreasing. And here are the details. So generally, if your income, if you look at the left-hand column, modified adjust gross income for years prior to 2018 is what they're looking at. If you make between $85,000 and $107,000 as a modified adjusted gross income, then you will have a percentage increase on your Medicare premium of about 35%. And this will change for the next category of individuals. Between 107,000 and 160,000 will change in 2018 to be 107,000 to 133,500. So again, that category of people who are paying 50% on top of their Part B premium will be lower or more. More folks will be paying that than were in the past. And then the next category, again, the limits are 133,500 up to 160,000 will pay 65%. And the next category, if someone is receiving a modified adjusted gross income of more than 160,000, 80% of the Medicare B premium will be attached to the maybe $134. It gets confusing. When we see real numbers, we will adjust these slides for the future, and we'll be happy to send them to anyone who's interested. So anyway, folks who earn a higher income contribute more under Part B, and they also contribute more under Part D. All right, another topic near and dear to our hearts is that Medicare is handing out new cards. There will be new cards distributed in waves to individuals between April of 2018 and April 2019. In fact, you may have already seen the Guard Your Card commercials and other information that is up. The old card, of course, is red, white, and blue. The new card is red, white, and blue, but there's a blue band at the top, which kind of distinguishes it. And the new card will not contain the Social Security number. The primary reason for making this change is to get the Social Security number off the Medicare card. It makes the person's accounts, bank accounts, everything else that they're involved with very apt to be hacked into or vulnerable. So this will be a brand new card. It will be a random bunch of numbers and a few letters that will be distributed to every individual between that time frame. And it will still say Medicare A or B and when the coverage starts. Cards will be mailed from April 2018 to April 2019. They'll be paper. If people have had an address change and they know Social Security doesn't know it, we recommend they call them so that the card doesn't end up in some other mailbox. people are being warned that there are already scammers out there calling folks to say, hello, this is your new Medicare card facilitator. Please give me a social security number. You'll get your card so much sooner than April 2019. Well, this is not Medicare, and this is a scam, so it should be reported to the police. So just as a reminder, people still have their social security numbers. It's only the Medicare number that's changing. Now we have some Medicare Planfinder updates and tips for open enrollment. There's a Planfinder tutorial on Medicare.gov, which is a very nice video, and it walks you through using the Planfinder. We recommend that people take a look at this before you start using the Medicare Planfinder. There's a lot on Medicare.gov. It's kind of fun to look under the different tabs and see what else is out there. But to find a Medicare health or drug plan, go to Find Health and Drug Plan. This Planfinder is a step-by-step overview on how to complete the plan search. And I'll give you a few more tips here as well. We recommend doing a personalized search. When people come to see us, they may not always realize that they're in extra help, or that they have some plan information that's already on the website. So we think that that's always a good idea to do a personalized search. Once in a while, however, we will be alerted that the particular website or the particular browser is not secure. So we do ask the person if we can continue. If not, then we'll go back and do a general search. As a reminder, it's so important to enter those drugs accurately and check with the beneficiary or pharmacy if any of the information is unclear. Whether there are duplicates. Sometimes you might have a couple of medications listed in a couple of different forms, or take a pill or take a half a pill, or if anything is confusing, it should be clarified before you actually finish your search. The pharmacy selection is important. Again, choose a couple of pharmacies and go through the whole process. Check for extra help, whether the person is on Medicaid or is on a SPAP plan or even a SCO, a Senior Care Options plan. That will make a difference as to the outcome of the information, which will be really important. All right, as a reminder, sometimes plans become suppressed or sanctioned during the year. A suppressed plan is one that has given inaccurate drug pricing to CMS. That data will be at the bottom of the results plan page, and the cost will not be shown accurately. If a plan becomes sanctioned because they did not stay in compliance with rules and regulations, if there's been a lot of problems in the past year, nobody will be able to get into that plan as a new subscriber. The person can keep the plan if they want to, assuming it's still around. But the data will only be enrolled through a personalized search and for them. All right, something that's very nice to see on the Medicare.gov Planfinder is when you type in the information, you'll see my current profile. And you can check and make sure it's accurate. There's a lot of information here. We can see the person's zip code. And actually, did somebody move in the last year? This is their current prescription drug coverage, PDP. It was effective the 1st of 2012. They have a current subsidy, which is full extra help. And the future coverage shows what they are taking next year. So they're going from a prescription drug plan to a Medicare Advantage plan next year. And their future subsidy is full benefit dual eligible. So something happened, perhaps the income or assets are both decreased, and now the individual will be fully covered. The drug list, we do recommend that people write down the drug list. Sometimes, computers, sometimes things happen. Sometimes electricity goes off mid-cycle, or we've had computer crashes where there are too many people toward the end of open enrollment. So we do recommend you write the drug list ID down somewhere and the password date. All right. The drug plan is usually refined every year in some small ways. This year, you can add or edit drugs during the drug list section rather than going back to the beginning to do that. So that's much more convenient, and that become annoying. So under the same drug costs and coverage tab, you can remove or add a pharmacy. So say you've gone through and, you've checked Walgreens, you've checked Rite Aid, but, what about the Walmart? What about Stop and Shop or something like that? So you can change out those pharmacies. Maybe you travel, every day an hour to go to work while you're on Medicare, and you could get to any of those other pharmacies. Maybe that's another way to look to reduce your prescription costs. So you can make those pharmacy changes, and you can expand the range of zip codes covered. Okay, again, we'll be looking at retail or mail order. A lot of people get mail order. The Planfinder has never been the best place for accurate mail order information. So we recommend that if you are doing a plan search, always check off retail pharmacy. You could go on to the particular pharmacy's website or prescription drug PDP plan's website afterwards and determine the reduced cost, if any, with a mail order pharmacy. Sometimes it's only a convenience rather than a reduced cost, so that is important to know. And again, please use the retail pharmacy dot on that section. All right, so sometimes we have people come and see us and they don't have any prescriptions. So during that situation, they'll often say, why should I pick up a prescription drug plan? And then we tell them about a penalty if you don't pick up the prescription drug plan during your initial enrollment period. So for these folks, they don't care which drug plan they get, except they do want the one that's least expensive, so we will point them to that prescription drug plan. We recommend that you write down the drug ID and password once you've started to go through the Planfinder with someone, and check for restrictions. How many times, has somebody said, listen, I've been on this medication for 5 years. The prior 10 years, I did step therapy. I had prior authorization. I've already been through this. So we want to look at the restrictions and see if we can find a drug plan for a reasonable price that doesn't have a lot of the restrictions people might be uncomfortable with. Again, go back to the video, the Planfinder guide, if you want to make sure that you're using the Planfinder correctly and not leaving anything undone. When you get to the enrollment confirmation page on the Planfinder, it's best to use Control-P. We've just found that it's a more reliable way to make sure that particular list gets printed, and we want to print that list so that we can give it to the individual to take with them. All right, you should be aware that on the Planfinder, you can see the 2017 plan data. People are still enrolling. People still have birthdays in 2017, so they're new to Medicare. They're enrolling in a prescription drug plan or Medicare Advantage plan, so they're using the 2017 data. You might be tempted to look at the 2018 data and get it all done in one fell swoop. I would not encourage that you do that now. Wait until October 15th, which is only 5 days away, and then it should be accurate and verified, and everything should be ready to go for 2018. All right, and you can see that there's a lot of information under the current plan. describes the annual costs, which can be a lot, what the monthly premium is, any deductibles and co-payments, other restrictions, and you don't want any restrictions if possible, and estimated health and drug costs, which look like a lot here. All right, the overview tab at the top is additionally useful. Links have been added to view the plan's website. So you don't have to actually get out of the Planfinder and go on to, Well Enough for Now prescription drug plan to look at their costs and verify them, or to see what pharmacies they use. You can actually get into that website from the Planfinder, which is really great. The other wonderful thing is you can look at the physician and provider network website. So again, this may increase the amount of time of the counseling session, but it will give you some very valuable information that will help the person make the decision sooner, which is really great. All right, and for health and plan drug benefits, this will give you more information about the specific drug plan. Here's Aetna Medicare Value Plan. It's a Medicare Advantage plan under Aetna. And again, it's an HMO plan. The phone numbers are listed, what the monthly health plan premium is, and deductible. The maximum out-of-pocket, remember I said a little bit earlier that there are a number of out-of-pocket maximums. In other words, a limit on the amount of money that the individual has to spend. So in this plan, it's $66,700. Some of them have been $3,400 and up to $10,000. So this is just good information. Some of the details about this plan that people need to also look at, it's not just the premium and it's not just the drug coverage. I wish it were that simple. Under the Medicare Advantage plans, will there be a cost if you're an inpatient? There's 360 days for the first 5 days, 0 for days 6 through 90. So that might be important for someone who is a frequent user of inpatient hospitals. Outpatient hospital coverage, again, is a range per visit. And physicians' visits vary by whether the physician is primary or specialist. And as you see, there's also a section which lists star rating, and that will be coming. It could be in the Aetna Value Plan, it will be a 5-star plan, so that's something that would be very attractive to people. And then you can look at your drug costs, etc., through those other tabs. All right, I think I've said this, 5 times maybe, but make sure the drug list is accurate. And I'll show you a couple of screenshots about what can happen when you've got variations in drug plans. So we'll look at the initial coverage level for a monthly quantity of 30 under the WellCare Extra Plan for 2017. And this is venlafaxine, HCLER. No doubt I pronounced that wrong, but you know what I mean. We have a capsule and we have a tablet available. So let's see what the Planfinder says. All right, if you look at the price under the tablet, the full cost of the medication is $207.40 for 1 month. Under the capsule, both of them extended relief, both of them 75 milligrams, it's $5.83. I'll sign it for the capsule, I think. So again, these changes are very important to make note of when you're helping somebody with a prescription drug plan or Medicare Advantage plan on the Planfinder. And here's another view of metformin HCl tab 1,000 milligrams. We have a tab 1,000 milligrams for $1.50. We have a tab 1,000 milligrams osmotic for $142.75. Then we have an extended release tab, 1,000, for $1,622.62. It's shocking. But these are some of the changes or differences that people see and call us and say, "Are you kidding me?" Yeah. So be very aware of that. The plan detail reports can be retrieved by printing print your plan details where it shows, print to the section of the page, print plan report. And your printable report can be customized. You can click on the boxes that you want. Generally, since we don't use a mail order, we don't click on those boxes. Otherwise, you get pages and pages that are not really pertinent to you. Another tip is, you see there's a little print or printer up at the top of the screen. Don't print that, because you'll get this lovely sheet of paper. You don't really want that. You want the report. So click print at the bottom of the page. And again, it will look like this. It lists all the plan details, drug costs, and coverage on this particular prescription drug plan. And just a couple of reminders, as we go through all of the prescription drug plan information, we ask people to keep an eye out for folks who may be eligible for extra help. The buy-in programs like Quimby, Slimby, or QI that help pay for Medicare Part B, you will get a pretty clear sense from people who come in to see you if they need help financially, if they're in economic stress. So we always screen for these programs and will help them with applications. And remind them of the benefits offered under Part B, the flu shots, the screenings. There's a lot of really good benefits. And we remind people that on the Medicare summary notice, there is a small section that's added to remind beneficiaries that they should not be billed if they are in the Quimby program. In other words, the program that's paying for Medicare Part B. They shouldn't be getting a bill, and if there's a problem, they need to call Medicare. The other thing we remind people about is they can sign up on mymedicare.gov to get those bills sent to their home, and that way, or to their computer, and that way they can keep really good track of them and be updated on an easier basis of all their healthcare activities. So we would like to remind people about that. And now we are at the questions segment.
Thank you so much for that thorough explanation, which is, can be super complicated and confusing for lay people like myself. And we do actually have some questions coming in. Before we go ahead and get to those, I'm going to take just a moment. Cynthia, if you want to go ahead, if you're able to go ahead and pass the screen back to me, that would be great. Because what I'm going to do, and thanks everybody.
I just want to show this here too. Yeah.
That's great. I believe I also had that on the last slide of my PowerPoint presentation, which I'm going to go ahead and transition to.
Right.
And I will, for those of you that are interested, go ahead and shoot me a question section of the GoToWebinar control panel to let me know if you would like to receive copies of our PowerPoint presentation. And before I go ahead, I do see some questions coming in. And before I ask you to handle some of those, Cynthia, I'm going to go over just a few things. We always want to remind our webinar audience that regardless of the healthcare coverage you have, please do reach out to NeedyMeds if you're having difficulty affording either a medication or another healthcare expense. A lot of people don't turn to NeedyMeds if they have some sort of insurance coverage. That's one of the problems we have here, is that people assume that NeedyMeds will only help people that don't have insurance coverage at all. And that's not the case. We certainly can't guarantee that we're going to be able to find a program for you, but I can guarantee we will do our best to make that possible. And I say, why not visit the NeedyMeds website, which is www.needymeds.org, or give our expert counselors a call, and that's 1-800-503-6897. And again, you'll see all of this contact information at the end of the webinar. But I always suggest reaching out because it won't take much of your time. It's completely free and it's anonymous. And I have up on the PowerPoint slide right there some of the cost-saving resources that we have, which include prescription assistance programs, which maybe you've heard of. Those are programs supported by pharmaceuticals that offer free name brand meds to those that qualify. We have a database of diagnosis-based assistance programs, which are programs that help for things that, for expenses that are related to diagnoses but don't fall neatly into the category of medications, such as durable medical equipment, testing supplies, things like that. We also have a pretty robust database of coupons and rebates. And of course, if we're not able to connect you to any program that will help you save, we will provide you with a free and anonymous NeedyMeds drug discount card. So again, don't hesitate to reach out to us. And one of the other things I wanted to point out, as evidenced by today's fantastically timely and thorough webinar, we do our best to partner with experts such as Cynthia to bring to your attention other resources and tips about diagnoses. So there's a sampling of some other diagnosis-specific webinars we have coming up later in the month, and you can find registration links for all of those at the bottom right hand of the NeedyMeds homepage under our calendar of events. As promised, I want to go ahead and put up the contact information, so you can feel free to jot that down. And Cynthia, please tell me if that looks accurate to you. And with that in mind, we're going to open the floor to some questions. One of the first ones that came through, and I think it's a really important one. It's a little bit, it's not, when I first read it, I thought it was complicated, but it's actually not. And I'd like to bring it to your attention, Cynthia, because I think it applies to a lot of people. Somebody wrote in, they heard that it's better, for example, to possibly take a drug at home under Part D because of the donut hole and its 5% limit. But this is where they're going with this question. Let's say if you take the same drug, but it's administered in a doctor's office or a hospital, and then it's covered by Part D, but there are no spending limits. Yet cancer drugs, for example, can be very costly. Is it possible to ask the doctor, can you do me a favor? Is it possible for you to give me this drug as a pill or in a different formulation rather than, for example, an IV at the office for me to save money? Is that something you hear a lot, Cynthia? And is that something that people should be inquiring to their doctors about?
We often do recommend that people talk with their physicians about their options.
Right.
You know, whether it's changing the form of the medication, sure, yep, or even the other way around. You know, sometimes people would prefer to have it in the doctor's office, and that works better for them. So
that's a good point.
Yeah.
So, and I would say that also goes for NeedyMeds. We would always say one of your first steps is to have a conversation with the doctor and see if they can prescribe, for example, and you hear this all the time, a generic instead of a brand name. If there's a cost savings option that they're aware of or can work with you on. But I think that really does answer the question, which is that you know, the answer is always going to be have that conversation. It certainly can't hurt.
Right.
Another question coming in is if somebody currently has Medicare or an Advantage plan, let's see how this is worded. If you currently have Medicare or an Advantage plan and want to keep the plan, do you have to take action or is it going to just stay the same?
It will just stay the same.
Okay.
And yeah, in fact, you know, you should probably have received information from your insurance company in September about any changes. And that sheet of paper should have said, if you don't want to make any changes, don't do anything. Yeah.
Okay, that's important. And it goes without saying, and correct me if I'm wrong, the contact phone numbers that are right there on your screen right now, both to SHIP and the websites as well. If for
Mhm.
some reason you have questions or you didn't get paperwork you were promised, I would imagine, Cynthia, we would direct people to those phone numbers. Is that correct?
Right.
Okay. Here's another question coming in. We have somebody that's helping a patient with Medicare entries. Is it required to put in an email address? Because a lot of people maybe don't have computers or any. They want to know, is that entry optional or is it obligated? That's pretty specific, but I think that's important
Yeah.
when you. I think that's important when
Yeah.
you're the one helping to complete these Medicare entries.
Right. I think the important thing. So you're talking about the consumer's email address.
That's correct.
Right, right. And that would be on the last stage of enrollment where they
I
ask
see.
for one. Yeah.
Yep.
We generally don't put one in there because it's not necessary. And
Okay.
we also don't advise emailing because the systems are not secure, like to not email the information or, which includes the Medicare number to anyone.
Great.
Yeah.
Great. And so that option, I mean, that is an option. You're
Yeah.
not obligated to put in the
Right.
email address at the very end of the stage.
Right.
Okay. What else is coming in? Um, I do think, again, it's a couple of things I wanted to stress before we wrap up today's webinar. In addition to the contact information there, as I said, if you're interested in receiving copies of today's PowerPoint presentation, Cynthia, I'll ask you to go ahead and email me separately an updated PowerPoint presentation you did today so I can share it with our audience. I just want to make sure I have the most updated version. We will be happy to send you not only copies of both my PowerPoint and Cynthia's as well, but we work right away to convert our webinars into a video posted on the NeedyMeds YouTube channel. And you can find our YouTube channel by going to the NeedyMeds homepage. And on the top right hand of the page, you'll see all these little buttons that'll connect you to Facebook and Pinterest and Twitter. And on those, among those little logos, you will see a link for our YouTube channel. We do our best to get those videos up there within less than a week. But as I just shared with one of our audience members, our video expert just went home sick in the middle of this presentation. So it may be a bit delayed, but we will absolutely get today's presentation up and running as soon as we can. So with that, Cynthia, thank you so much for taking time to join us and share your expertise with the NeedyMeds audience. We deeply appreciate your taking a very complicated and it down so we can all understand it. So thank you for that. Thank you to our for taking days to join us, and we do hope you join us for a future NeedyMeds webinar. Thank you so much, everybody, for your time, and here's wishing everybody happy and fun. Take care. Thank you.
Thank you.